Hi, my name's Ashley Casem. I'm a balance and vestibular physical therapist at Physical Therapy and Balance Center in Rockville, Maryland. And at Physical, we have a pretty comprehensive balance and vestibular program. So we see patients experiencing vertigo, we see patients experiencing generalized dizziness and disequilibrium. And diagnoses that we work with, we see BPPV, both typical and atypical. We see patients that have vestibular hypofunction, whether that be from vestibular neuritis, labyrinthitis, exposure to ototoxic drugs. We have experience working with patients that have Meniere's disease, vestibular migraine, acoustic neuroma, and we see patients that have both acute and chronic dizziness. So the great thing about our clinic is that we have several pieces of equipment and technology that can be really helpful to us in diagnosing and treating vestibular disorders. So we'll show you just a few of those. So one piece of equipment that we have is our infrared video goggles. These goggles have a camera in the lens that projects a patient's eyeball up onto our television screen. And these goggles are great because they can help us accurately identify and interpret nystagmus, and they can help us to pick up on some things that we probably would miss with just the naked eye. So just to show you an example, here's a quick video of a patient that came into the office with an acute vestibular neuritis. And I was the first healthcare provider that this patient saw, and this is what we saw when we put the goggles on. So you can see that the nystagmus is really easy to pick up on when we have the eyeball magnified. The goggles are really great for this. So needless to say, this is a really nice tool. This can help us make a really quick and accurate diagnosis. So some other equipment that we have computerized posturography testing, which is basically a formal balance test that gives us nice objective data about a patient's balance. And we also have what's called a safety overhead system. This involves putting a harness on a patient and attaching the harness to an overhead track so that we can prevent falls while we test and train balance. We also have what's called our balance shuttle, which is basically a platform that's attached by 4 chains. So this is one of the pieces of equipment that we use to help train a patient's balance. As far as treatment goes, if a patient has BPPV, we are going to perform some kind of Canalith repositioning maneuver. In some cases, it's as simple as doing an Epley maneuver. In other cases, it can be a little bit more complex. If someone comes in with a hypofunction, we will do a lot of habituation and adaptation exercises. We will work on that patient's balance. And in general, we really work to educate patients and help them manage their symptoms. If you have any questions at all, please feel free to reach out. Here is our contact information, and thank you for your time.